urology. He's been kind enough on the last minute to get dragged into this. So, but Dr. Dineen is one of the most accomplished urologists I've ever met in my life. And, you know, he's a phenomenal guy, very humble, and he's on the AUA Foundation board and you know, leader of one of the largest urology groups around, and a real global expert on urology issues. And we're going to focus today on enlarged prostate. So Dr. Dineen, could you tell me a little bit about what exactly is an enlarged prostate and how do you treat that?
Well, thank you, Joe. First of all, thank you for inviting me here. I think this is really wonderful. You've got a great turnout, and I understand you have great success heading up toward New York City, or toward the New York area, with a really novel means of calling attention to a little bitty gland that causes an awful lot of trouble for at least half of the world. Since prostates are unique to men, and men make up about half of the world, I figure that about half of us out there can have troubles with the prostate gland. You know, the prostate serves both a reproductive purpose as well as a oops, we're losing some of our set here, but the prostate serves a dual purpose. I refer to myself as a plumber, and our plumbing can require maintenance as we age, and as we age as males, our prostate tends to grow, and as it grows, it can tend to squeeze down on the urinary tract and make it a bit more difficult for some of us to urinate or to void, to empty out our metabolic wastes. So as urologists, we provide that service to people in our communities, and it's important to keep prostate health, not just from a mechanical standpoint, but as many people are aware or have heard of over the years, prostate cancers can cause problems for many of us as well.
And so, how do you recommend treatment for patients, or do you recommend treatment, and how do you approach a patient that comes in and is having some difficulty urinating? Where do you start? Where do you end?
Well, we try to figure out how bothered an individual is by his prostate. Is he up all night not getting any sleep? Is he just getting up once at night as we age? So bothering, how much an individual is bothered by the nature of their prostate gland plays a significant role, and much of our diagnostics focuses on that. As regards treatment, prior to the 1990s, really the only method of treatment was surgical intervention. And since that time, we've had quite a development of various medical manipulations that can save a man surgery. And there are, in fact, some of the sponsors of this program have come up with some of the newest gadgets, a little way of opening the prostate channel, much the same as you see a stage curtain opened in plays that are done in various theaters, etc. So there's a whole range of treatment modalities, from just conservative measures, essentially doing nothing, just watching, to medications, to surgical intervention that requires anesthesia. But that's why we ask folks to come on down and see their local friendly urologist, just as they would call their plumber if something was wrong in the house. That's what we're here for, to help fix them up.
Any parting words in terms of what advice you give to men out there for men's health, and ways they can take better care of their prostates?
Well, I'm not sure about taking better care of their prostates, but women do a much better job of taking care of themselves, I think, traditionally than men do. And I think men's health overall is important, particularly as we age. We all only get just so many miles on the engine, as we know, and as all these cars will attest to. And in a way, we're not a heck of a lot different from that. And our job as urologists is to be good mechanics for our men out there. And so I would recommend that if when fellas are having trouble with their plumbing, that they come on down and see their local friendly urologist who can help make their life a heck of a lot better.
Again, thank you so much, Dr. Dineen, for coming on such short notice, and I really appreciate you taking the time.
No troubles, and good luck to you, Joe. Thank you for doing this. It's a great project.
Woo! So we're going to just do a quick demo of a new treatment option for BPH, something called UroLift. I know Dr. Dineen had kind of talked about it a little bit. So basically, we're going to show. Maybe we'll come over to the booth, right? I'll come over. So I'm just going to show you guys a new innovative treatment. don't worry, this looks a bit scary, but it isn't. But essentially, as Dr. Deneen was talking about, you know, one of the biggest problems we have with enlarged prostate is that it can kink or obstruct the flow through the urethra. And so there's a company by the name of Urolift that's come up with a NeoTrack that's made a device called Urolift, which is a very innovative way of essentially tacking the prostate apart, the lateral lobes. Now, the key thing when you have enlarged prostate is that you can think of it as a donut, and the inner part of the donut gets a little bit enlarged or thickened. And so how this device works is it fires a very small needle out to the outer part of the prostate, and essentially deploys a little retractor needle or kind of a tack that basically squeezes or holds the lateral lobes of the prostate apart. What's amazing about this device is that it does this with very minimal cutting. We do this procedure with the patient asleep, so you don't feel anything. But essentially what we're doing is pulling the lateral lobes of the prostate apart gently with very little irritation. So what's nice about this is it improves the ability for the patient to pee or urinate a lot better in terms of their flow, but also causes very little irritation, very little bleeding, you know, frequency, urgency, things like that. And so we really think that it's got tremendous potential, and you know, please feel free to visit our website, and we'll kind of, you know, there's a little information about the site, and we'll have like a little animation about how the device works, and we'll publish that later on today. So still stay tuned, and hopefully we'll show you some other devices too. Now I'll just kind of quickly show, is this the live one? That's not the live one, right? So you know, basically this deploys through a cystoscope, and this is the device that allows us to squeeze the prostate to basically fire the tacks. And basically online, you know, we'll kind of show a demo or animation of how this works. But again, the key thing is to reach out, talk to your urologist, your doctor, and there's lots of minimally invasive treatment options available for patients nowadays. So with that, thank you guys, and we're going to head out soon now to the next stop, and you know, feel free to stay online, and we'll continue our live transmission. Thank you.
Fred, where are you, Fred?
We miss you.
Fred!
We miss you, Fred.
Hello, Fred, are you watching?
So these are some of the technical issues we have.
Fred is our videographer, and he's stuck in.
Unfortunately, he got stuck in traffic.
He's always stuck in traffic. But Fred, we love you.
But we got Ben from Skillful Antics.
Skillful Antics taking over. Thank you guys so much. And while we're here, we want to thank all of our sponsors again. We want to thank the Drive for Men's Health, and you can view all of our sponsors, including Genomic Health Care Clinic, South Lake Hospital Da Vinci, Hitachi Aloka, Urolift, Percuvision, Irby, VTI, Skillful Antics, DJ Doctor, Dia, Arthromet, KDX Pathology, SmartRx, Conversation, Ramses, and the thing is falling on us! Star, City of Claremont, ACT, Mental Health Network, Family on My Own, TES, South Lake Hospital, I Need Water, Soma Cloak, Lake County, Florida, Kaiser Urology, Claremont Community Pharmacy, Florida Poly, Michigan Alumni, Central Florida, Healthtronics, Green Life Fire Bag, and Dr. Paracottle, the amazing urologist that he is. So we're going to sign off the live broadcast here for a few minutes. As you guys can see, we're all charging up. It was charging, but I have another charger in the car. Yeah. So then these are all the cars here with us. Hey guys, how are you guys doing?
Excellent. How are you?
Yeah. Tesla, thank you guys.
Happy to support.
And then we got everyone here getting ready to go. And this is how we charge the car. Yeah. So this is how we kind of charge the car here. That's the charger. And then we're basically off. So basically what we're going to be doing is we're going to this thing, but actually, you know what, we'll probably log on again from the road. So thank you guys, and then we'll be back on in about 5 or 10 minutes. Thank you. Okay. Oh, Ben, this was yours, man.
Yeah.
Oh, sorry, man. I didn't know that was yours.
No, it's okay. Is this closing?
Where's my Wi-Fi?
Are we closing this down?
Where's my laptop?
It's on this chair, I think. Did you want to stop this?